Muhlenberg Community Hospital was established as a not-for-profit hospital by Dr. G.L. Simpson in 1938. Following Dr. Simpson's vision of continued growth, improvement, and modernization, our hospital has continued to meet the healthcare needs of our community, registering over 89,000 patient visits in 2009. The economic, health, and social benefits that Muhlenberg Community Hospital provides to our citizens cannot be overstated. Our hospital is the largest private employer in Muhlenberg County with approximately 525 employees. Total payroll and benefits exceed $20 million. 89% of Muhlenberg Community Hospital employees are residents of Muhlenberg County. Indirect economic benefits are derived from 38 physicians, their staff, and supporting service companies. Muhlenberg Community Hospital has provided 11 physician scholarships to local students, encouraging them to return home to practice. With Medicare and Medicaid representing 72% of the hospital's revenue, total unreimbursed cost to Muhlenberg Community Hospital for healthcare in 2009 was over $3 million. Other benefits provided at no cost to the community are sports medicine, community programs, and physician scholarships and guarantees. Including these and the many other benefits provided at no cost, the total economic benefit exceeds $23.2 million to the community.
The multitude of services Muhlenberg Community Hospital offers makes a tremendous impact on your health. Physical therapy right here at home, getting you back in the game of life. Surgical services offered locally, allowing you to heal at home. Cardiac rehabilitation, strengthening and restoring individuals following cardiac events. Emergency services and ambulance, here 24/7 for you and your family. Long-term care for those requiring skilled services or rehabilitation. Coal Miners Respiratory Clinic, providing specialized respiratory care. Inpatient care, providing compassionate quality care to those requiring hospitalization. Home health, allowing patients to receive their care while remaining in their homes. Radiology, with its state-of-the-art equipment, including MRI and CT scan.
Recently, I had bilateral knee replacement at the hospital. Dr. Genevieve did that, and then I went from there to long-term care for a little while because I was needing some extra help with some bend and stuff. One of the things I liked about going locally was the fact that I did know the people, or they knew me, and it's people that you see at the grocery store, or that you see at Walmart, or you see at church. So I knew them and they knew me, and they wanted me to succeed as much as I wanted to because they would be seeing me. My mother had surgery and she had it somewhere else, and she got good care, but it wasn't personal care like what we got. You know, they would come in, they would ask about my kids, they would ask about my grandkids, and it was really, I mean, I knew they really cared. When my insurance refused to pay for a machine that would bend my knee once I was at home, they got on the phone, the therapy department got on the phone with my doctor, and they made some calls, and then the therapy people wrote up a thing telling that I had a need for that because of the shape that my niece was in, and that over the long run it was going to cost the insurance company more if they didn't take care of it. But they made the effort and they got the machine for me and then had it delivered to my home. I would definitely recommend that someone use the local hospital for several reasons: the convenience for yourself and for your family, the trips back and forth, because with therapy, you know, you have to go several times, and it would have been hard on my family as a whole, even to visit. I would recommend it because of the care that you get. Every department, I was in long-term care and I was on bank unit, and the surgeons, everyone there. So I would definitely recommend it, if for nothing else, for the care that I received when I was in the hospital in all areas.
Well, I was recently in our hospital here in Greenville, and the care I got from the nurses on acute care, in surgery, the lab, everywhere was just wonderful. They just make you feel at home, make you feel welcome, and I just think they're a great bunch of people working there.
I had surgery recently here at Muhlenberg Community Hospital. It was back in December of this year. Being in the community, it's close to the elderly, the young, emergencies, and it would be very difficult to have to run to another county or somewhere for the hospital.
In comparison to other hospitals, I would recommend our hospital to anyone, because I feel like there you're not just a number, you're a person, and they really care about you.
I've been going to this hospital since 1948. This hospital is special to me.
We are all guilty of taking for granted some of the most important people and things in our lives until we lose them. What impact would losing Muhlenberg Community Hospital have on your life and the life of the community? What would it be like to live in Muhlenberg County without a hospital? To answer this question, we only need to look at our neighboring county, McLean County, which lost its hospital in 1997. Compared to Muhlenberg Community Hospital, which currently has 38 practicing physicians, McLean County now has 0. McLean County property values dropped and their tax revenue decreased. Would you be safe?
I was at work, and all of a sudden I had a pain in my right side. I know my heart's on the left side, but in my right side. And I got nauseated, which was all the signs. And it lasted about 15 minutes, and I told her that my wife, that we was going to the hospital. Wonderful to have a hospital 15 minutes away from where I work and be able to get in here, and they rushed me in. They knew my history. My past history was a 6-way bypass. The staff here is just unbelievable, and they treated my family just like family, and a lot of them know my family, and it's just having a hometown hospital. There's nothing like it. Without it, we'd all feel lost. I was really, really happy that I didn't have to go to another town to come here and work out and do all the heart rehab that you do. Monitored, checked out, someone with you all the time. It's just no better place to go. And to have this in your own hometown, and you don't have to go to another city. And then some of the other cities are actually full. That took a day or two to get in here, but it didn't take long. And once I did, they just did wonderful treatment. They just got the most wonderful staff here in the world.
What about your loved ones?
Dr. Simpson said, "We must continue to build, improve, and modernize, or the institution will die on the vine." These words have never been more true than today. The rapid change in healthcare delivery, the high cost of modern medical equipment, below-cost reimbursement for Medicare, Medicaid, and charity care, and competition from area hospitals are jeopardizing our ability to grow and provide modern medical equipment and facilities. Without your support, Dr. Simpson's words of caution will become our reality. So the next time you have an opportunity to support our local hospital, please do. Your health care is your choice. Our future is in your hands.